You, Director Prusak and esteemed board members, for the opportunity to address you today, and I want to extend a warm welcome to the new board members as well. My name is Jana Champagne, and please bear with me as I provide some context for today's commentary from myself and my cannabis nurse colleagues from the Cannabis Nurses Network. I am a medical cannabinoid science professor, a board-certified master herbalist, and I was licensed as an RN in Oregon until 2022, when I retired in protest of the discriminatory policies against cannabis nurses and their patients by the former Oregon State Board of Nursing members. For nearly a decade, I dedicated myself to educating cannabis patients and medical professionals on this science. I know many Oregon licensed nurses impacted by this issue, and they are reluctant to speak out without protective anonymity, given the troubled history with OSBN regarding our specialty. However, I'm hopeful that you, as the new OSBN members under the leadership of new Executive Director Prusak, will exhibit receptivity to the importance of our messages today. My contact with OSBN on this issue began in 2015 when I started educating cannabis patients professionally, and I reached out for scope guidance. I followed OSBN health education guidelines per OR 851-045-00609A as advised, ensuring my education of patients was supported by evidence-based citations to safeguard my license. In 2019, I was encouraged by the publication of the National Council State Boards of Nursing, or NCSBN, guidelines by policy analyst Gretchen Koch, which outlined these national practice parameters for nurses serving medical marijuana patients. I hoped that OSBN would move towards adopting these detailed guidelines, which emphasize the need for nurses to receive education in cannabinoid science and follow best nursing practices to ensure competent cannabis nursing care in this state where we've had legal access to medical cannabis for more than 25 years. These guidelines are vital to ensure nurses understand the required competency measures and know the expectations for nurses providing cannabis patient care. However, in November of 2019, OSBN evolution regressed when the former members of the nursing board issued an interpretive statement of ORS 475B.785 prohibiting the education of cannabis patients by Oregon nurses. This gag order, as we called it, hampered nurses' ability to bridge the education gap faced by Oregon cannabis patients and consumers, thereby forcing them to procure medical information from less reliable dispensary resources. This increases the risk of therapeutic failure and harm in cannabis patients and consumers, with the primary risk being interaction with concurrent pharmaceuticals, which retail staff are clearly not trained to do. We further have research reflecting that competent medical cannabis guidance is necessary both for improving patient outcomes and reducing their risks. This paper further identifies the primary barriers impeding delivery of appropriate